Every single year, hundreds of thousands of older adults in the United States experience a myocardial infarction, which is the medical term for a heart attack. Here is something many people do not fully realize, and it is perhaps the most critical fact we will discuss today. During a heart attack, every single minute matters. The human heart is an incredibly resilient organ, but its muscle cells depend entirely on a continuous, uninterrupted supply of oxygen rich blood. When that blood supply is cut off, cardiac muscle cells begin to suffer irreversible damage within just 20 minutes. The longer the delay in restoring blood flow, the more heart tissue is permanently lost, which drastically reduces the chances of a full recovery and increases the risk of long-term complications like heart failure. This is why understanding exactly what to do in those first precious moments is not just helpful information. It is a medical necessity that can mean the difference between life and death. To truly understand why the techniques we will discuss are so effective, let us take a closer look at what is actually happening inside your cardiovascular system during a heart attack. Your heart relies on a network of specialized blood vessels called coronary arteries to deliver the oxygen and nutrients it needs to pump blood throughout your entire body. Over many decades, factors such as elevated cholesterol, high blood pressure, inflammation, and normal aging can cause a sticky substance called plaque to build up along the inner walls of these arteries. This slow process is known as atherosclerosis. For a long time, this plaque might just sit there, narrowing the artery slightly, but not causing any obvious symptoms. This is where things become important. A heart attack rarely happens simply because the artery slowly closes up over time. Instead, it usually occurs when a piece of that accumulated plaque suddenly cracks or ruptures open. When a plaque rupture occurs, the body views it as an internal injury and rushes to repair it. The immune system and blood clotting cells, known as platelets, immediately converge on the site of the rupture. Within a matter of seconds or minutes, these platelets stick together and form a localized blood clot over the damaged plaque. If that blood clot grows large enough to completely block the coronary artery, the flow of oxygenated blood to a specific region of the heart muscle comes to a sudden and complete halt. Deprived of oxygen, the affected heart muscle cells enter a state of severe distress, and if blood flow is not restored quickly by medical professionals, those cells begin to die. This is exactly why medical experts frequently use the phrase, "time is muscle." The entire goal of emergency medical treatment is to break apart that clot and reopen the blocked artery before permanent, widespread damage occurs. Now, recognizing when this process is happening can be more complicated than you might think, because many seniors are surprised to learn that a heart attack does not always look like the dramatic, sudden chest-clutching events we so often see in movies or on television. One common misunderstanding is that you must feel severe, crushing chest pain to be having a heart attack. In reality, the early warning signs can be subtle, and older adults, women, and individuals with diabetes are particularly likely to experience atypical symptoms that are easy to ignore. While classic signs include a sensation of heavy pressure, squeezing, fullness, or pain in the center or left side of the chest that lasts for more than a few minutes, the discomfort can also radiate to other parts of your upper body. You might feel a dull ache or numbness traveling down your left arm, or even your right arm. You could experience pain in your jaw, your neck, your upper back, or even your stomach, which can easily be mistaken for simple indigestion or heartburn. Beyond pain or discomfort, there are several systemic signs that require immediate action. Shortness of breath can occur completely on its own, even without any noticeable chest discomfort, because the heart is struggling to pump efficiently, causing fluid to back up slightly into the lungs. You might experience a sudden break out of a cold sweat or feel inexplicably lightheaded, dizzy, or faint. Nausea, vomiting, and a profound, overwhelming sense of unusual fatigue that comes on without any clear physical exertion are also major warning signs, particularly for women and older individuals. It is crucial to understand that these symptoms do not have to be severe to be dangerous. They can start out mild and gradually build, or they can come and go over the course of several hours. If you feel that something is fundamentally wrong, or if you experience any combination of these signs, you must treat it as a medical emergency right away. This brings us directly to our very first and most critical life-saving technique, which is the immediate activation of emergency medical services through the precise execution of the emergency call protocol. The moment you suspect that you or someone next to you is having a heart attack, you must immediately pick up the phone and dial 911. This is where things become important. Do not call your primary care doctor, do not call a family member first, and do not wait to see if the symptoms pass after taking an antacid or resting. Every single second you hesitate allows more heart muscle to be deprived of oxygen. One of the most dangerous mistakes an individual can make is attempting to drive themselves to the hospital or asking a spouse or neighbor to drive them. Here is why that matters. When you call 911, the emergency medical technicians who arrive at your home are not just a ride to the hospital. They are highly trained professionals who bring an advanced emergency room directly to your living room. Paramedics can perform an electrocardiogram or EKG the moment they arrive, which allows them to identify a heart attack instantly. They can administer specialized intravenous medications, provide supplemental oxygen, and begin stabilizing your heart rhythm immediately. Furthermore, if you are in the back of an ambulance and your heart goes into a dangerous, life-threatening rhythm, the paramedics have the equipment and training to shock your heart back into a normal rhythm on the spot. If you are driving in a car and that happens, the result can be catastrophic. Additionally, when an ambulance arrives at the hospital, the patient is brought directly into the emergency department or the cardiac catheterization lab, bypassing the crowded waiting room entirely. While you are on the phone with the emergency operator, there are two specific practical steps you must take while you wait for the ambulance to arrive. First, if you are alone, you should immediately walk to your front door, unlock it, and turn on an outside porch light. This sounds simple, but if your condition worsens and you become unable to open the door when the paramedics arrive, they will have to spend precious minutes breaking down the door to reach you. By unlocking it in advance, you ensure they can walk straight in and begin treating you without a single moment of delay. Second, you should find a safe, comfortable place to sit down, ideally on the floor with your back supported by a wall or a sturdy piece of furniture, or in a supportive armchair. Sitting on the floor is actually preferred because if you become lightheaded and faint, you will not suffer a dangerous fall or a head injury. Keep your knees bent to help ease the workload on your cardiovascular system, and remain as still as possible to keep your heart rate from climbing. Our second life-saving technique involves a medication that many of us already have in our medicine cabinets: aspirin. If you are experiencing a heart attack, taking aspirin can significantly reduce the risk of serious complications and improve your chances of survival, but it must be done correctly. Let us take a closer look at how aspirin works during a cardiac event. As we discussed earlier, a heart attack is typically caused by a blood clot forming over a ruptured plaque inside a coronary artery. Aspirin is a potent antiplatelet medication. It works by preventing the cells in your blood from sticking together, which means it helps stop that life-threatening blood clot from growing any larger. By keeping the clot as small as possible, aspirin allows whatever tiny amount of blood can still squeeze through the artery to keep reaching the heart muscle, buying you precious time until you reach the hospital. However, the way you take the aspirin matters immensely. You should not simply swallow the pill whole with a glass of water. Instead, you should chew the aspirin before swallowing it. When you chew the medication, you break it down into tiny particles that are rapidly absorbed through the mucous membranes of your mouth and stomach, allowing the medicine to enter your bloodstream much faster than a whole pill that has to be slowly dissolved and digested. The standard recommended dose during a suspected heart attack is usually 1 adult aspirin, which is 325 milligrams, or 2 to 4 low-dose baby aspirins, which are 81 milligrams each. It is vital that you use plain, uncoated aspirin for this purpose. Coated aspirin is designed to resist dissolving in the stomach to protect your digestion, which means it takes far too long to work during an acute emergency. Now, this does not mean that every single person should automatically take an aspirin the moment they feel chest discomfort. There are critical safety exceptions that you must be aware of. You should never take aspirin if you have a known allergy to it, or if you have been explicitly told by a doctor that you must never take aspirin due to a high risk of internal bleeding, such as a history of severe gastrointestinal ulcers. Furthermore, if you are already taking a prescription blood thinner, or if you are unsure whether your symptoms are truly a heart attack, you should always verify with the 911 emergency operator whether it is safe for you to chew an aspirin while the ambulance is en route. The dispatcher can guide you based on your specific medical history and emergency protocols. The third life-saving technique focuses on managing your body's intense physiological response to stress through controlled, calming breathing techniques. When a person realizes they might be having a heart attack, it is entirely natural for panic and terror to set in. However, severe anxiety triggers a massive surge of stress hormones, specifically adrenaline and cortisol, from your adrenal glands. This sudden influx of adrenaline forces your heart to beat much faster and causes your blood vessels to constrict, which rapidly drives up your blood pressure. For a heart that is already struggling to survive due to a blocked artery, this sudden increase in workload and oxygen demand is incredibly dangerous. It can cause the heart muscle to fail even faster and can trigger fatal irregularities in your heart rhythm. To counteract this dangerous adrenaline surge, you can use a structured breathing pattern to intentionally activate your parasympathetic nervous system, which acts as a natural brake for your body's stress response. One highly effective method is a slow, rhythmic breathing technique where you inhale gently through your nose for a count of 4 seconds, hold that breath very briefly for just a second or two, and then exhale slowly and completely through pursed lips for a count of 4 or 5 seconds. As you focus entirely on slowing down your breath, you send a direct signal to your brain that helps lower your heart rate, decrease your blood pressure, and reduce the heavy oxygen demand on your cardiac muscle. It is absolutely vital to emphasize one common misunderstanding here. Performing a breathing technique does not stop the heart attack. It does not dissolve the blood clot, and it does not replace the need for emergency medical care. The entire purpose of controlled breathing is to manage your panic and stabilize your body's internal environment so that your heart muscle is under the least amount of stress possible while you wait for the paramedics to walk through your door. It is a tool to preserve heart function and maintain mental clarity during a highly stressful emergency situation. As we look deeper into this topic, it is important to address several dangerous internet myths that have circulated widely over the past few years, as these falsehoods can lead to fatal delays in care. Perhaps the most prominent and hazardous misconception is the idea of cough CPR. This myth claims that if you are alone and having a heart attack, you can save your own life by coughing repeatedly and violently every 2 seconds. This is completely false and highly dangerous, according to the American Heart Association. The concept of cough CPR is derived from a very specific, rare scenario that sometimes occurs in a controlled cardiac catheterization laboratory under the direct supervision of a cardiologist. In that clinical setting, if a patient goes into a specific sudden arrhythmia called ventricular fibrillation, a forceful cough can momentarily maintain blood flow to the brain for a few seconds until the doctor can deliver an electrical shock. It is entirely useless for a standard heart attack caused by a blocked artery at home, and the extreme physical exertion of violent coughing actually increases the strain on your heart, making the situation much worse. Another common myth is that drinking a large glass of water mixed with cayenne pepper or consuming specific herbal remedies can instantly stop a heart attack. There is absolutely no scientific or clinical evidence to support this claim, and attempting to mix a remedy or locate herbs in your kitchen wastes invaluable minutes that should be spent calling 911. We must also address the misconception that a heart attack is exactly the same thing as cardiac arrest. While they are related, they are distinct medical conditions. A heart attack is a plumbing problem caused by a blocked artery that cuts off blood flow, meaning the heart muscle is being damaged, but the heart is usually still beating. Cardiac arrest is an electrical problem where the heart suddenly and unexpectedly stops beating entirely, causing the person to collapse and lose consciousness instantly. A heart attack can lead to cardiac arrest, which is precisely why immediate medical attention from paramedics is so critical. We must also look closely at the common mistakes that seniors frequently make when facing a potential cardiac event, so you can avoid these pitfalls completely. One of the most frequent errors is dismissing the symptoms as simple indigestion, acid reflux, or muscle strain, and deciding to wait it out or try to sleep it off. Many people hesitate to call 911 because they are afraid of causing a false alarm, or they feel embarrassed about an ambulance showing up at their home if it turns out to be nothing serious. You must remember that emergency medical personnel would far rather respond to a false alarm than arrive too late to save a life. Never wait for symptoms to disappear, because every hour of delay drastically increases the amount of permanent damage to your heart muscle. Another widespread mistake is calling a family member, a neighbor, or a friend before calling 911. While it is completely natural to want emotional support from a loved one when you are scared, calling them first adds unnecessary steps to the emergency chain. Your family member cannot provide advanced life support, they cannot perform an EKG, and if they have to drive over to your house, you have lost critical time that paramedics could have used to begin life-saving treatments. Additionally, some seniors try to finish a household chore, tidy up their living room, get dressed into specific clothes, or pack a bag before calling for help. Please understand that paramedics do not care if your house is untidy or if you are in your pajamas. Their only priority is your heart. You should also avoid walking around, pacing, or performing any physical activity to try to shake off the pain, as any movement increases the metabolic demands on your struggling heart muscle. While knowing how to respond to an emergency is vital, the ultimate goal is to prevent a heart attack from ever occurring in the first place by managing your personal risk factors aggressively. This is where regular communication with your primary healthcare provider becomes your greatest asset. High blood pressure, often called the silent killer because it rarely causes noticeable symptoms, places continuous excessive strain on the walls of your arteries, making them far more susceptible to plaque accumulation and rupture. Working with your doctor to keep your blood pressure within a healthy target range through a low-sodium diet, regular activity, and prescribed medications is a cornerstone of cardiovascular health. Similarly, managing your cholesterol levels is essential for stopping the progression of atherosclerosis. High levels of low-density lipoprotein, or LDL cholesterol, provide the raw material that forms dangerous plaques inside your coronary arteries. If your physician prescribes a statin or another cholesterol-lowering medication, it is vital to take it exactly as directed because these medications do more than just lower your numbers. They actually help stabilize existing plaques, making them less likely to rupture and cause a heart attack. For individuals managing diabetes, keeping your blood sugar and hemoglobin A1C levels tightly controlled is equally critical, as chronic high blood sugar directly damages the lining of your blood vessels and accelerates cardiovascular disease. Incorporating a heart-healthy dietary pattern, such as the Mediterranean diet or the DASH diet, which are rich in vegetables, whole grains, lean proteins, and healthy fats, while avoiding tobacco smoke and engaging in regular moderate physical activity like walking, can profoundly protect your cardiovascular system over the long term. Let us take some time to address several frequently asked questions that many older adults have regarding heart attacks to ensure absolute clarity on this topic. A very common question is, Can a heart attack happen completely without chest pain? The answer is an absolute yes. As we highlighted earlier, this is known as a silent or atypical heart attack, and it is particularly common among seniors, women, and individuals who have lived with diabetes for many years. In these cases, the classic nerve pathways that transmit pain signals from the heart can be altered, leading the individual to feel only a sudden wave of profound weakness, unexplained shortness of breath, a cold sweat, or mild upper back discomfort. If you experience these unusual symptoms without a clear explanation, never assume it cannot be a heart attack simply because your chest does not hurt. Another important question is, should every single person automatically keep aspirin on their nightstand just in case? While keeping fresh, uncoated aspirin readily accessible in your home is a very smart safety measure for most adults. You should always consult with your doctor at your next routine checkup to confirm that you do not have any specific medical contraindications that would make taking it dangerous for you. It is also wise to check the expiration date on your aspirin bottle regularly, as medication can lose its potency over time, and you want to ensure it is fully effective if an emergency ever arises. People also frequently wonder if acute psychological stress or sudden anger can actually trigger a physical heart attack. The medical evidence confirms that a sudden, severe emotional shock or an intense outburst of anger can cause a massive, instantaneous surge of stress hormones that can cause an unstable arterial plaque to fracture, leading to an immediate blood clot. This is why learning to manage chronic stress and utilizing breathing techniques to stay grounded is valuable for both long-term health and acute situations. Finally, many seniors who live alone ask how they can best survive an event if no one is there to help them. The protocol remains exactly the same. Do not panic. Immediately call 911 on your phone. Unlock your front door so help can enter. Chew your plain aspirin if it is safe for you to do so, and sit flat on the floor with your back supported to await the arrival of emergency personnel. You can also prepare in advance by keeping a concise list of your current medications, allergies, and emergency contacts in a clear folder on your refrigerator or near your front door, where paramedics can easily find it the moment they walk in. To bring everything together, let us summarize the 3 essential, life-saving techniques we have covered today so they are firmly planted in your memory. The first technique is the immediate execution of the emergency protocol, dialing 911 at the very first sign of symptoms, never attempting to drive yourself or waiting to see if things improve, unlocking your front door, and sitting safely on the floor to prevent injury. The second technique is chewing a single adult uncoated aspirin or up to 4 low-dose baby aspirins to rapidly introduce the antiplatelet medication into your bloodstream, helping to stop the life-threatening blood clot from growing larger, provided you have no medical contraindications or allergies. The third technique is utilizing controlled, rhythmic breathing, inhaling slowly through your nose and exhaling fully through pursed lips, to intentionally suppress your body's panic response, lower your heart rate, and protect your heart muscle from the damaging effects of an adrenaline surge while professional help is on the way. Please remember that this information is meant to empower you, not to frighten you. By understanding the true physiology of a heart attack, recognizing the early and atypical warning signs, and knowing exactly how to execute these 3 structured techniques, you are taking an incredibly proactive step in safeguarding your health and the health of those you cherish. Always listen to your body, never hesitate to seek professional medical emergency care, and continue to work closely with your healthcare provider to manage your blood pressure, cholesterol, and overall cardiovascular wellness. Thank you so much for spending this time with me today. Stay safe, take care of your heart, and I will see you next time.